Hello, I'm Betsy Ross, and welcome to Healthline. Stroke is the third leading cause of death behind heart disease and cancer. Today, we're pleased to announce that our first segment is sponsored by River Hills Healthcare, and Dr. Jim Farrell will tell us what we need to know to help prevent a stroke. Our second interview is sponsored by Health South, and we'll learn about their cutting-edge rehabilitation therapy. That's all next and more on Healthline, presented by the Northern Kentucky Medical Society. Our first guest today is going to help us understand what we need to know about strokes and what we should do if symptoms appear. Dr. Jim Farrell, a neurologist, is from River Hills Healthcare. Doctor, thank you for joining us today.
Well, thank you very much for having me.
We hear the term strokes and we throw it around and maybe not know exactly what that entails, but you have some startling statistics about strokes.
Well, yes, stroke is extremely common. There are over 700,000 strokes that occur in the United States each year. And to put that in perspective, about every 3 minutes, someone actually dies from a stroke. About every 45 seconds, someone experiences a stroke. In the course of a 30-minute television program, another 40 people will have had a stroke. Another 10 people will have died from a stroke. And the reason I think this is so important is that the goal of any healthcare system should be to improve the quality of lives of our patients. And we try to do this by, of course, preventing death. But the other thing we try to do is prevent disease from interfering with their life. And if it does, we call that disability. Stroke is the third leading cause of death, as was mentioned, but it is also the leading cause of disability in this country. So if you combine cause of death and disability together, stroke is number one. In fact, it should be the number one goal of any healthcare system, to try and prevent the consequences of stroke.
So what exactly happens when someone suffers a stroke?
Well, a stroke basically is an interruption with the blood supply to the brain in one way or the other that results in the death of nerve cells. And when those nerve cells die, the symptoms of a stroke develop.
Two types of stroke. What are they? Explain the difference.
The two basic types of stroke are a hemorrhagic stroke and an ischemic stroke. The hemorrhagic stroke, as on the graphic, is on the right side, and that is about 15% of strokes. Much more common, the ischemic stroke on the left. The ischemic stroke is when a blood clot lodges in a blood vessel, and the brain tissue that is supplied by that blood vessel then dies. With a hemorrhagic stroke, a blood vessel breaks in the brain and bleeding occurs within the brain, causing death to the tissue where the bleeding occurred. So they're two very different causes of stroke and very different treatments.
Are there people who are more susceptible than others? What are the risk factors? What are some that we can control and maybe some that really are out of our control?
Well, it's a very good point, because some things, of course, we cannot control. We cannot control our age. As you get older, your risk of stroke increases. And of course, we cannot control our genetics. We cannot control what we inherited, which of course includes our gender, includes our race, and includes our family history of having a tendency to have stroke or heart attack, particularly at a young age. If someone in your family had a stroke or heart attack, usually in their 40s or their 50s, you are at increased risk of having stroke yourself.
Okay, those are the things that we really can't do anything about. Right. How about some of the things that we can do something about?
Well, this is, of course, where we need to concentrate on something that we can have an impact on. And number one is high blood pressure. In fact, if I was to list 10, I'd list the first 5 as high blood pressure, because it's so important to control blood pressure. It is the number one risk factor for stroke. A history of heart disease, of course, is a history of having difficulty with the blood vessels. If you have difficulty with the blood vessels to go to your heart, you likely have some trouble with the blood vessels to go to your brain. Smoking is a very important controllable risk factor. And the reason smoking is so important is that if you stop smoking, within several years, the risk of having stroke or the change that smoking has on your blood vessels reverses to the point where it's the same as someone who never smoked. So it's double incentive to discontinue smoking your cigarettes. Diabetes is a risk factor for stroke, which of course is controllable through control of your blood sugar levels. Your cholesterol level is controllable, of course, through medication. And there's a rhythm in your heart called atrial fibrillation. If you develop this rhythm in your heart, it predisposes you to form blood clots in your heart, which can break off and go to the brain. A big risk factor for stroke, which is very controllable because your doctor can put you on medication to prevent those blood clots from forming. So those are some of the risk factors that are controllable for stroke.
So we've talked about just how debilitating a stroke can be, how fatal a stroke can be. How important is it for us to make sure that A, we know the warning signs, and B, do something very quickly when we see some of those warning signs?
Well, certainly what we talked about before was the ounce of prevention, which of course is very, very important. And now we're talking about the pound of cure, of course, which is what happens when we start developing the symptoms. And I think the most important word to remember is sudden. If you have the sudden onset of weakness or numbness on one side of the body, if you have the sudden onset of difficulty with your speech, difficulty with your balance, sudden onset of loss of vision, those are all indications that you may be experiencing a stroke. However, if you see someone who you're not sure whether they're experiencing a stroke or not, the word I want everyone to remember is FAST, F-A-S-T. And the reason for this is you're examining someone yourself. You're not a professional. How can I know whether this person is having a stroke? Well, the F in the word FAST stands for face. And what I would like people to do is to look at the patient or look at their family member and try to get them to smile. If they notice that one side of the face is weak, that's an indication they may be experiencing a stroke. The A stands for arm weakness. What I'd like them to do is tell them to put their arms out in front of them. If they notice that they can't lift one of their arms or one of their arms starts to fall on one side, that may indicate that they're experiencing a stroke. The S, of course, stands for speech difficulty. Ask them what their name is. Ask them what your name is. If they have difficulty with that being slurred, if they have difficulty saying that word, that also may be an indication that they're experiencing a stroke. And the T in FAST stands for time. It's very important if you see any of those symptoms to get the patient to the hospital as quickly as possible. Don't wait and call the doctor or try to call the answering service. Call 911 and get to the hospital, because the sooner that they can determine the cause of what's going on, the sooner they can treat you and possibly prevent the consequences of stroke.
Another term that we hear often when we talk about strokes or hear about strokes is TIA. Explain a little bit of that to us.
Well, this is very important, and thank you for asking this question, because sometimes when people are experiencing symptoms, within several minutes or within a half an hour, they go away. And they think, great, now I'm safe. Maybe I'll just call the doctor on Monday and set up an appointment and go in and talk to them about these symptoms that I had. And that is a mistake, because TIA is a big risk factor for experiencing a stroke in the near future. If you experience a TIA, in other words, you have the symptoms of the stroke, but then they go away, again, get to the hospital as quickly as possible, because that's a warning sign for a stroke that's imminent, and you need to have treatment as soon as possible to try and prevent that stroke from occurring.
So if you had one or two pieces of advice for all of us about strokes, what would it be?
Well, I think the most important thing, of course, is to get to your doctor and have them assess your risk factors, because you need to have them check your blood pressure, check your blood sugar, check your cholesterol, help you with discontinuing cigarette smoking, and help you with those lifestyle changes that will help prevent stroke. That's the most important thing, preventing stroke. But if you experience the symptoms, again, sudden onset of symptoms, and remember the acronym FAST if you're worried about a family member who may be experiencing these symptoms. And then if they are experiencing these symptoms, get them to the hospital as soon as possible. Call 911, because if you arrive in time, there are some treatments that are possible for stroke, ischemic stroke or hemorrhagic stroke. Great advice. Thank you so much for being here. We really appreciate it, Dr. Farrell. We will be right back with more right after this.
That's the number. 6 out of 10 Americans are now in debt. That's over half the country. So if you're in trouble with debt, you're not alone. If your credit card bills are piling up and your balance just isn't going down, call Consolidated Credit now. They'll get the credit card companies to reduce or eliminate your interest. They'll consolidate your bills into one easy payment. And they'll cut your monthly payment by up to 50%. All that so that you can pay off your debt fast. 6 out of 10 people may be in debt, but one call to Consolidated Credit can get you out. They're the freedom people.
Only Consolidated Credit has the Freedom Quest program. Call now, 1-800-530-5706. 1-800-530-5706.
Consolidated Credit. When credit card debt is the problem, they're the solution.
For some of us, retirement is today. For others, it's down the road. But wherever you may be on your path in life, we at Central Bank are here to guide you. With a comprehensive selection of financial services and expert advice, we'll help you meet all your needs for today, for tomorrow, and for your future. Central Bank, showing you the way.
And now it's time for Medical Minutes. According to a recent study reported in the British Medical Journal, researchers found that occupational therapy can help patients with mild to moderate dementia. These patients showed improved motor skills and needed less help with everyday tasks. Caring for those suffering from dementia can be stressful, and this valuable information not only will help the patients, but their caregivers by helping ease the burden. Next, a recent study from the researchers at the Fred Hutchinson Cancer Research Center seems to indicate that obesity may more than double the odds of prostate cancer death among men newly diagnosed with the disease. These findings are preliminary and need further study, but if correct, it would be one more reason for men to reach and maintain a normal weight. And finally, some interesting news coming from Northwestern University. A study suggests that music training boosts sensitivity to pitch and may give musicians an edge when learning a new language. Recognizing different pitches makes it easier to recognize the different tones of a new language. So, well, it looks as if those piano lessons can also help your child in Spanish class. That's the Medical Minutes for this edition of Healthline. We'll be right back after this break. Rehabilitation from a stroke can sometimes be a long and very difficult process. Our next guest, Greg Wainscott, is going to show us an innovative therapeutic device that's helping lots of patients regain their walking skills. Greg is a physical therapist assistant at Health South, who is the sponsor of this segment. Welcome, Greg. Thanks for being here.
Oh, thank you, Betsy.
This is a very special piece of rehab equipment that only Health South has. Tell us a little bit about the auto ambulator.
Okay. Yes, it's a very exciting piece of technology that we have. We're the only facility locally in the tri-state area that has this type of technology. And what it is it's a sophisticated robotic device that allows patients to relearn how to walk, whether they suffered from stroke, multiple sclerosis, spinal cord injury, a variety of different neurological problems.
Looks a little bit like a treadmill, but with a few other whiz-bangs around it. Explain what it does.
What it is based upon the principle of body weight support treadmill training. That's why we have the treadmill. And what that is it employs a suspension system which will help to lift and lower a patient onto a treadmill path. At the same time, there are robotic legs that the patient is attached to, if you will, and those allow the patient to relearn to walk in a normal pattern.
It sounds very high-tech. Let's take a look at some video that we have of this machine and just get a look at exactly what it does and how a patient benefits from it.
Sure. We're looking at a patient here who has suffered from a stroke, has some impairment on the right side of his body, and what I'm doing is attaching some very simple elastic straps comfortably to the patient's thighs, Likewise, I'm going to take some elastic straps and attach them just above the ankle. And what these will do is they will serve to allow us to, as I mentioned, attach the patient's leg to some robotic legs. There's a harness that will go around the patient's waist. We use a variety of different harnesses depending on the patient's ability. This patient obviously can stand and can walk somewhat well as, also. So we use a very simple harness for him that we'll use here as he approaches the treadmill. He'll step onto the path. And you can see the robotic legs that we've mentioned. It's in the forefront there, just in front of the patient. Those will be attached to those elastic straps that are around both his thighs and his ankles.
Do patients have to have a measure of ability to be able to use this machine?
Well, we use this with patients that are unable to walk, unable to stand, maybe even unable to get out of a wheelchair, for instance, independently. So this particular patient is able to stand and walk somewhat well, but we will use this also with patients that may have no ability at present to walk, with hopefully the eventual goal that they will be able to regain some of that function.
Now, his feet don't look like they are on that treadmill.
You're right, Betsy. When we first connect the suspension system and the legs to the patient, they are suspended, so they are up in the air. And when we begin the therapy session, we'll start very gradually, very slowly to move those legs in a normal walking pattern. As the patient accustoms to this motion, the therapist will begin to lower the patient down onto the treadmill, and you'll see this patient beginning to accept his own weight on the treadmill so that they can best assimilate what they would normally do when walking over ground. Here the machine is stopped. The machine has certain safety measures in place that will make sure that the patient is safe and moving freely as they can while they're using the device. And then here, as you can see, the patient's legs are on the treadmill path. We're monitoring on this screen here, which is right next to the autoambulator, how much of their weight that they're accepting as they walk. We're also taking a look at the speed at which they're walking. We, as you saw, we start very slowly, but we try to increase the speed to a normal cadence. We're going to look at both the distance and the steps taken to cover a particular distance, and then, of course, the amount of time that they spend on the device, actually walking over the treadmill.
Now, how much of this is powered by the patient, and how much is just following what the robot does?
That is a good question, and that does depend on the patient's ability. If the patient is able to, for instance, bring their knee forward or bring their hip forward, we want to really encourage and facilitate that motion. We want the patient doing as much as they can, and the machine will allow that to happen, and we can measure how much the patient actually puts into the motion of walking. Likewise, for a patient that's unable to do those sorts of things, the machine can do all of the effort it takes to make those steps.
So in the overall picture, what are the benefits of having this kind of a machine, the autoambulator, help patients get back mobility?
For our center and for our patients here in the community, it allows us to start the rehabilitation process a lot earlier than it would without this type of device. And that's very important when someone's recovering from a stroke or another type of neurological condition, that the rehabilitation process starts as soon as they're ready, as soon as they're medically stable. So that's one benefit. We can teach patients to begin walking long before it would be a safe way to teach that same skill without this kind of device. Secondly, they're learning to walk the way that they would hope to walk when the rehabilitation course is over. We want patients to learn to walk with as less physical assistance as necessary, or with as few assisted devices, whether that be a cane or a walker. And this machine, as you can see, allows the patient to walk freely without having to use the assistance of those types of devices.
And I'm sure that each patient is different, but how soon do you try to get them on this autoambulator?
As soon as they're medically stable. A lot of times a patient who has suffered a stroke is going to come from an acute care hospital to our facility, and they may spend a few weeks with us as inpatients, just like they would at a normal hospital, with a very regimented focus on the rehabilitation. So once they're accepted to our facility, that's an indicator that the doctor feels they're medically stable, and we could begin using that device right away upon their admission.
It's an awesome device, and as we said, really the only one in this area like it. It certainly has opened up, I'm sure, a lot of possibilities for you and your patients to get them back on their feet, literally.
It really has, and that's what's exciting to us as therapists. to the doctors that are caring for those patients and then for the patients and their family themselves.
Greg, thank you so much for showing us the machine. I think we've learned a lot. Thank you so much for showing us this new technology.
You're welcome.
Appreciate it. After this break, we have local doctors answering your questions in our House Calls segment. Stay with us.
We all take different paths in life. At Central Bank, we understand this. With a comprehensive selection of financial services and expert advice, we'll help you meet all your needs. Whether you're getting your first home, preparing for a growing family, or planning for your children's futures, Central Bank is always there for you. Central Bank, showing you the way.
Hi, I'm Chef Tony, and now there's a knife so sharp you can cut a pineapple in midair. It's the Miracle Blade 3 Perfection Series. This is my all-purpose slicer, the ultimate in slicing knives. You'll also get rock and chop, rips through ribs, plus you'll receive my fillet and boning knife, fillet fish right down to the skin, and my chop and scoop. Chop parsley and fresh herbs in seconds. Watch, flex, and scoop right to your favorite recipe. And you get my paring knife. Curve to peel fruits and veggies. I'll also send you 4 steak knives. Call now and you'll get my Perfection shears and a second Miracle Blade slicer absolutely free.
But wait, we'll send you a second complete set of knives free. Just imagine, that's now nearly $500 worth of knives for just one payment of only $39.95. And if you don't think the Miracle Blades are the best knives you've ever used, just return them for a full refund. So call now.
Our House Calls segment gives you, the viewer, an opportunity to ask questions about your medical concerns. We have doctors from the Northern Kentucky Medical Society ready to answer your questions. Our first question comes from Ellen and Gary in Alexandria. My husband and I have been married 8 years and we're in our late 30s. We have not been able to get pregnant and I'm concerned that something may be wrong. How long should we keep trying before we go to a specialist? And what kind of doctor should we see? Well, we asked Dr. Sharif Awadallah to answer this question.
Ellen and Gary, we now know that for women, there are slight decreases in fertility that occur after the age of 35, and they occur on a year-by-year basis. Because of that, it's now recommended that if you've been trying for 6 months to a year and have not been successful, it's time to seek some evaluation. You don't have to be afraid that this means complicated, expensive procedures or difficult treatments. In most cases, we're able to do simple, office-based testing and give you information. As far as who to see, a lot of patients will turn to their family physician, their obstetrician, gynecologist, to an infertility specialist for evaluation. Who you want to see depends a little bit on how much you want to get done as soon as possible.
Dr. Nancy Swikert answers this question from John in Newport. My 53-year-old sister is taking sleeping pills every night to help her sleep. I'm afraid she will become addicted. Should I be concerned?
You know, John, that is a really hot topic right now in the medical world. There's a lot of doctors that are very concerned about the use of sleeping pills, and there are some new sleeping products that have come out on the market. We really like to be sure when we prescribe sleeping medicines that we've done a thorough medical exam, because there are some medical diseases that can cause sleep disorders, and you wouldn't want to just take a medicine and not take care of a problem. So doctors are very cautious in using sleeping medicine because we feel many of them are addictive. And we would prefer that if you do need sleeping pills, that you use the smallest dose possible and try to use it as briefly as you need it to get rid of your condition. In other words, maybe taking some time off from the medicine, or maybe skipping some days, or talking with your doctor how you can avoid those issues. But these are very good points to be brought up with all of the marketing today about sleeping medicine on the television and in the newspapers.
And our final question comes from Bill in Northern Kentucky. My wife is 71 and gets out of breath if she walks from the living room to the kitchen. She experiences pain in her legs and has no energy. We're caring for our 2 grandkids, and we need all the energy we can get. What might be causing the pain, and is there anything that she can do? We went to Dr. Barry Dick for this answer.
Bill, the pain in her legs could be due to many different causes, including arthritis, back pain, back problems, or vascular problems, blood vessel problems. And her doctor could probably sort that out with just a physical exam, checking for pulses at her groin, behind her knee, and at her ankle level. If he feels it's a vascular problem, he should probably refer her to a vascular surgeon who can guide the workup at that point, either simple Doppler ultrasound or in some cases an angiogram, and then go over the treatment options. I'm a little concerned about some of her other symptoms, however, her shortness of breath and generalized weakness, which may not be related to the leg pain, and I definitely think she needs to see her family doctor with those symptoms.
And our thanks to Dr. Sharif Awadallah, Dr. Nancy Swikert, and Dr. Barry Dick for their professional medical advice. Well, we have come to the end of this month's show, so we would like to thank our guests, Dr. Jim Farrell and Greg Wainscott. Very special thank you to our sponsors for their participation in this edition of Healthline. Now, if you've missed some of the information listed on today's program, or if you have a question that you would like answered in our House Call segment, be sure to go to the Northern Kentucky Medical Society website and then click on the Healthline button. All of our program information is listed there, and you can email us your questions. Each of our Healthline programs will air numerous times each month, so make sure you check your listings for the days and the times. We hope you will join us again next month for a new program when we will learn about the services available at the Northern Kentucky Health Department. Goodbye for now. I'm Betsy Ross, and this has been Healthline, presented by the Northern Kentucky Medical Society.
Would you like to double, triple, or even quadruple your income and eliminate your credit card debt?
I make $5,000 a month in residual income.
Income is at a 6-figure income. We'll be making over $8,000 a month this month.
Our first month we made over $3,000 right out of the gate.
Thousands of people are getting started by requesting a free DVD that shows them the way to financial freedom. Like Trina, a soccer mom who started her home-based business part-time and with the help of a mentor made $30,000 the first year and $130,000 the next. Or Brandy, who has now become financially secure and is living the American dream.
The free DVD really opened my eyes.
We made over $18,000 last month.
And there's no experience necessary. Our DVD shows how a mentor works with you to assure your success.
Go to 92getmoney.com and get started today. And respond now while this is still a free service. Go to 92getmoney.com. That's 92getmoney.com. 92getmoney.com.
Hi, I'm Nancy James, and if you haven't seen Northern Kentucky Magazine on ICN6, here's what you've been missing. New York Times best-selling authors, chefs creating their magic in our kitchen, music of every type performed by the Tri-State's finest musicians, local celebrities, and friends from your community with important news to share. The only thing missing is you. So join us every weekday at 10:30 a.m. for an hour of fun on Northern Kentucky Magazine on ICN6.